So the next one we have to do is to review is Down syndrome. So Down syndrome is actually very interesting background. The causes is from a chromosome called trisomy 21. It's more likely to become like for a mother to have a child with Down syndrome by birth by mothers older than 35, and usually it's around that age because mothers don't usually have babies much older than that because of menopause. So these are the interesting things to think about. So I would like to talk about, let's talk about some of the diagnosis and assessments we're going to be using for these kids, because that's really important, and then we can talk about the clinical manifestations of the uniqueness of what we would see in a Down syndrome child. Okay, so pre-delivery, we may be able to diagnose screenings and diagnostics. So some of the screenings include they're like a triple screen, a quad screen. These are just saying that they're able to detect if they're to guess if they're going to have a child with Down syndrome. Some of the diagnostics are to make sure. So screening is just to screen, but then the diagnostic is to is like the official. There's a cryonic villus sampling, amniocentesis, and percutaneous umbilicus sampling. I wouldn't say I would memorize, I would just say I understand what a diagnostic is, and that mothers do have the option to screen for these for Down syndrome, and they may choose to have an abortion. So if make sure as a nurse to not have, be judgmental, if that makes sense, as this is purely the mother's choice of what they choose to do with the information. Post-delivery, you'll see physical features that are very there's very physical obvious features of a Down syndrome child. And there's chromosomal analysis to make it official, but you'll be able to, I'll explain when I'm doing my clinical manifestations explanations. So that's interesting. There's a Denver test for the growth and development to always monitor. You can do those with all children. Physical and neurological, all children, and respiratory. It's just that you really want to watch the physical, neurological, and respiratory even more with Down syndrome children. And the Denver test is really helpful to watch for growth and development of children. All right, so some of the interesting physical manifestations, there's so many places we can start, but I like to separate it out from there's physical, there's psychological standpoint, and the clinical and the intellectual and behavioral standpoint. So we can talk about from the intellectual standpoint. 7% of Down syndrome children have autism. They may have oppositional and aggressive disorders of like very argumentative, aggressive, oppositional. They have strong feelings a lot of times. ADHD is very common. So autism and ADHD often can be together. So they may have Down syndrome and autism, Down syndrome and ADHD. So that's interesting. And on top of the behavior of oppositional aggressive behavior. Many disabled with Down syndrome are disabled intellectually, but the degree is very it's on a spectrum, and some may be more disabled than others. Some may be just totally mainstream. So most can do basic tasks, just takes a little bit longer. So it's giving that caregiver, letting them know that they can have some sense of autonomy possibly. It just depends on how severely affected they are and what physical or psychological and intellectual degrees of capacity they have. All right. So some key physical characteristics I'm going to share is to point out is that 75% have sleep apnea. I'm not sure why, but this is just one of the things that I saw from the PowerPoints and resources that I've seen. Women usually are fertile and men are not. This is pretty interesting. So let's say a Down syndrome child is a very oppositional behavior problem, and they just decide to go, woo, they just start having sex with everybody, and all of a sudden they have a baby and pregnancy. And there's stories out there that say don't take advantage of my child. She's Down syndrome. She doesn't know what she's not 100% there. And so just be mindful that women can get pregnant with Down syndrome, and if they are not able to take care of that baby, that is very dangerous. because who's going to take care of it? So there was a story that I heard from our teacher that the mother of the Down syndrome child was taking care of her child. So these are just things to think about and make sure to educate. They may have distinct features of like small, low set ears. Many times Down syndrome children have hearing loss. They're prone to infections due to that canal not being 100% developed. So these are things to think about. So watch for those infections, and you should be treating very promptly, because this can lead to hearing loss in Down syndrome patients. They grow more slowly and they gain more weight. So that kind of makes sense. So if you're shorter, you're going to gain more weight. So that makes sense. So just be mindful of that, and that for these Down syndrome patients. They also have distinct features of like short and broad hands with a specific Semenian line on the palm. And they may have a protruding tongue. So protruding tongue, that simulant line on the palm, grow more slowly, they gain more weight. They have a wide space first and second toe. These are just extra stuff. It doesn't harm them. There's other things also. They have a small head, flattened head in the back, so it may be flat in the back, flattened forehead, and a flat nose. So these are just distinct features that you'll be able to tell, and that you should make precautions as a nurse to what to monitor for, because internally there's things going on. So these are just external features. It doesn't externally, these are just distinct features, but really we got to worry about our physiological things. So these are our physical things, but not physiological. Other things are their eyes will slant upward like that. They have a Brushkill spot. I gotta look what Brushkill spot means real quick. Brushkill spot. Well, this will be interesting because it's a surprise to me too. So Brushkill spot is a white or grayish brown spot on the periphery of the iris in the human eye due to aggregation of connective tissue on normal iris element. The spots are named after the division. So they literally have like, it's very interesting. So it's small white or grayish brown spots in the periphery of the eye, of the iris of the human eye. So good to know. So these are just extra characteristics. Other things to be mindful is they can have congenital cataracts, which is the eye epicanthal eye folds. This is just like it's just a different kind of eye fold. Nearsightedness, farsightedness, astigmatism. I actually have astigmatism, but it's also associated with eye problems with Down syndrome children. So I have astigmatism. It's not exactly the funnest. But I use glasses to correct them. So you can also teach them to have glasses. Cross-eyed or abnormal movement. So their eyes may cross-eyed. So watch for that. A wide and short neck with an extra skin on the back of their neck. So they'll have an extra skin in the back. Thickened skin on the palms and soles and of their feet. And flaky on the scalp. And pink marbly skin, but dry. So these are just extra things. So what I really want to focus on is the physiological elements and what we should monitor for these Down syndrome patients, because it's really important to watch for them and monitor for the risk, because they're at high risk. And I remember that I went to a camp with Down syndrome children, and it was called Camp Sternberg, and I remember that I was, there were certain cabins for Down syndrome children, and we were allowed to, in other cabins, we were allowed to help, like, be friends with them, like peer friends. And they had such lovely personalities. Like, it was actually a very like deep sense of emotions. I can't explain it. And yes, they have a Pacific look, and I do know that, but I remember I got swine flu that year. And I remember I would never forget how they said, Down syndrome, you have swine flu, like you have to go to the sick house. And I was like, I don't want to go to the sick house. And they were like, yeah, but you're actually literally in danger of the people with Down syndrome. And I was like, what do you mean, like danger? Because I think I'm in danger. I think I'm sick, like I'm in danger myself. But I wasn't thinking of Down syndrome kids that are actually more in danger. I didn't understand the physiology behind it. I thought it was just a look and that it was just a physical thing, but it's a physiological thing. There's things going inside that are very specific to that chromosome, extra trisomy chromosome, and they really are more infection. And I explain why when I had swine flu, I really did have to go to the sick house. I had to have this tape around the sick house with all the people with swine flu in it, take the medication and be treated before I can go out and try to not get those, because the children with swine flu, with Down syndrome, getting an infection is a lot more dangerous and can be deathly in comparison to someone who is not immunocompromised like me. So I'm going to explain why. So congenital heart defects are common, like PDA, that's one to be mindful of, but I think I want to talk about the other ones more. So there's a risk of an upper respiratory infections, and why? So they're at risk for they have an underdeveloped nasal bone. So the nose, they're at risk for upper respiratory infections because of this underdeveloped nasal bone. So the mucous membranes tend to dry out because the nasal bone is underdeveloped. Aspiration risk, and this is due to, so on top of this nasal bone drying out, increased for infection, because that moisture and that mucus is exactly what traps that mucus. So if you don't have that, that increases risk for infection. Now, aspiration is also associated with risk infection, but this can happen due to other reasons. They have hypotonicity, so that's a low tonicity of the chest and the wall abdomen. So usually that keeps your diaphragm, you think of, and your muscles here to prevent you from aspirating, but it's because of that weakness of their chest and area of the wall of the abdomen, they're at higher risk for aspiration, unfortunately. Other risks associated with Down syndrome, not saying every Down syndrome child has this, but there's many things that are very prevalent in the Down syndrome community. Leukemia is a high risk. I'm not sure exactly the correlation, but this is a high risk associated with Down syndrome children. And their because of this leukemia risk, they also have an immune system risk. Also because of the nasal bone being underdeveloped, this hypotonicity, aspiration always makes you more at risk for infections, so things to think about. Also, it was really interesting is that hypothyroidism and type 1 diabetes is really, really associated with Down syndrome as well. And atlantoaxial instability, the instability of the neck, has been really associated with Down syndrome. Which is really dangerous, and we'll talk more about that with the interventions. So 5% abnormal digestive organs and celiac disease has also been associated. So they have multi-organ problems, your thyroid, your hypothyroidism, diabetes, your digestive system, your immune system is weaker, leukemia is a high risk, the aspiration with the hypotonicity of the chest, also increasing risk for infection and aspiration, the underdeveloped nasal bone are things to think about, and your congenital heart defects, just having good perfusion are things that we think about. So that's the main things. So now we can think about all the interventions that are really, 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 really important to think about when we see a Down syndrome child, what is the nurse's job to focus on or teach the family members about. All right, so first we're going to talk about, you want to evaluate their sight and their hearing because they are at risk for hearing loss and sight. So especially when they're really young, you want to continually monitor. Good hand hygiene is really important for the nurses as well as the parents, everybody around them, because they're already at risk for infection just regardless. So a normal person should also wash their hands though. So these are things just to think about. It's emphasizing that they're more at risk. All right, so electrocardiography is monitoring their heart soon after their birth, and regular medical care because they are more at risk for cardiovascular problems. As we were saying, PDA is one of the associated problems, cardiovascular problems. So their congenital heart defects are common. You want to also, for the basics, monitor their height and weight. There's special charts because of their slower growth, so you want to make sure they're going on the growth pattern, but it's okay that they will go on a slower growth pattern because they're trisomy 21. So just know that there's special charts for that. All right, so the team members that will be in care are a few people. So you're going to have your clinical geneticist, your pediatrician, so that's child, everybody has, so geneticist is because it's specific for Down syndrome, they're specialized in that, so that makes sense. Your pediatrician, everybody has a pediatrician, that's when you're a child, so that's pretty common. A pulmonologist, this is because their risk for those infections, the upper respiratory infections are really common because of the underdeveloped nasal bone as well as the hypotonicity of the chest. Ophthalmologist is for the eyes. They are known for having cataracts and farsightedness, nearsightedness. We also think about our astigmatism, cross-sightedness. They just have, in the Brushkill spot, but those are just things to think about when you think of eyes. A dentist is always important. Everybody has one, should have one if they have insurance, of course. A neurologist, because of this neurologist and neurosurgeon, especially if they have that axial instability, that's why you would have a neurosurgeon and a neurologist monitor for that. Orthopedic, a psychiatrist for the mental part complications. A physical therapist to help with their walking, OT, occupational therapy. They need extra help to do basic tasks. Just intellectually understanding what they're supposed to do, and speech language, they may have hard control with their speech and language development, as well as audiologist if they're having hearing problems, which is commonly associated with Down syndrome. So there's a lot of collaborative care going on with Down syndrome often, if they have money, of course. So this is just suggestions, to be honest. Okay, so hold on. So we want to talk about what you should be monitoring. There's specific guidelines of what you should monitor for Down syndrome. So the growth of the birth should be monitored at 2, 4, 6, 12, 15, 18, and 24, and then once a year after age 2. So 24 months is age 2. So 2, 4, 6. Then you skip to 12, so half a year, then a year. Then 15, 18, 24, 18. Yeah. So this is this age is when you're checking growth, because you want to make sure that they're having good nutrition, especially since they grow slower. At 4, tell the doc if the child snores, sleeps in an unusual position, or does not sleep well, because sleep apnea is really associated with Down syndrome. Hearing checked at birth, and then once a year after that, because they often have hearing loss, and they have underdeveloped bone connection, so they can have otitis media, which is really associated with Down syndrome, a complication, as well as vision, 6 months, and then every year till 5. Okay, every 2 years from 5 to 13, and every 3 years from 13 to 21. So they're continually monitoring for their vision. But the truth is I monitor my vision like every year, I'm pretty sure, based on whatever my family's insurance is. So those are things to think about, because I mean, I have astigmatism. So if you already have a vision problem, often you check in every single year. So I'm not sure about those guidelines. Muscle and nerve, any visit, any problem walking, bladder, control of the neck, especially pain. If you see any tilts in the neck, one side, muscle weakness, that's a lanceal instability you're monitoring for associated with that. So that's why you would want to, if there's ever a nerve problem, you want to be able to tell the doctor. Thyroid problems, 6 months and 12 months, and then once a year after that, you want to monitor for, because the hypothyroidism is something associated with Down syndrome. A heart ultrasound before and after birth, because it has Down syndrome is really associated with congenital heart defects, and blood, birth 1 to 21. So you really want to monitor their blood and their perfusion as well, especially hematocrit, hemoglobin, and your basics. All right, so after monitoring, there's going to be feeding, just simple things like feeding factors and pharmacology I want to talk about. For their feeding, because this is like something that's day to day once they start eating, you want to give them small, frequent meals. There's a special spoon, there's a long, straight handled spoon that helps for protruding tongue thrust, because they may not be able to swallow so well because of this tongue thrust associated with Down syndrome. So a long straight handled spoon really helps with this feeding. Push food toward the back and side of the mouth. This can help. So just like a technique for teach caregivers and parents for this, about this. Increase fluid and fiber. This will help with digestion because they may have slower gut mobility. I'm pretty sure this was it says 5% has abnormal digestive organs and celiac disease. So just try to increase that fluid and fiber. Gastric motility is slow, predisposes for constipation. So we know that, and that's why fiber helps in fluid as well. And monitor for obesity because hypothyroidism is really associated with Down syndrome and increases risk for many problems of just really rapidly gaining weight because of not digesting to that level and that thyroid gland not working adequately. Now let's talk about some of the pharmacology. The pharmacology is not like directly aimed at like, oh, you're Down syndrome, you're gonna have this drug. It doesn't really work that way. We're gonna look at the symptoms and the problems associated with it, and that will determine what drugs this child is on. So you wanna monitor for that respiratory tract infection because of that hypotonicity of that chest and the wall and the abdomen and dysfunction of the immune system. You wanna monitor if they have leukemia, just in case, or they have a risk for just infections in general, just because their nasal bone. Other pharmacology, so that's just monitoring. That's not actually a drug. I was just saying monitor for respiratory tract, just throwing that out there. The treatment of otitis media could cause hearing loss if it's not treated. So it's really important to basically treat that otitis media immediately because that could just lead to hearing loss, and that's a devastating thing, and it's really hard to take care of. So the least caregiver strain possible would be the better. Digitalis, which is the same thing as the digoxin, and diuretics for the cardiac. So digoxin helps cardiac output. Diuretics help lower that hypertension. So it depends on what the problem of the patient is really. For thyroid, we're going to want to use thyroid medication replacement for hyperthyroidism. I remember that's really important whenever someone does have hyperthyroidism to keep on the same medication and be consistent. So it prevents intellectual deterioration, and when you use thyroid, because if you're slow, you're going slow, your whole body is going slow because metabolism is really important, and it'll affect your brain as well as the whole body. So it will prevent intellectual deterioration and improve the individual's overall function if they have hyperthyroidism and they need that thyroid replacement. Their academic achievement, their vocational ability. So yes, make sure that if they're low in thyroid, they need that thyroid replacement. Infantile anticonvulsants for Down syndrome children who have seizures, they'll need an anticonvulsant, and infantile spasms with steroids. Another thing to really monitor, make sure for, is that they need immunizations for pneumonia, influenza, vaccines, because they are high risk and they really need to be vaccinated, Down syndrome children. So those are the main pharm things to think about. Also, so for mucous membranes, because they're nose and they dry out and they're not really protecting them against infections, and it's really containing all that gunk. You want to make sure that their breathing's okay. So they also have hypotonicity as well as their back of the throat and their protruding tongue and all that stuff. But their nose, we're going to talk about their nose. So clear the nose with a bulb syringe, just like when you see with the baby's bassinets. Wash out the mouth after each feeding. Use cool mist vaporizer to keep the mucous membranes moist. So we want to keep that area moist and try to help to prevent that infection. And also there's other techniques like frequently changing the child's position, perform postural drainage and percussion. This can help. Drain before each feeding, the nose, and because child can gag and interferes with feeding. So yeah, make sure you do all that. So mucous membranes we want to think about. The last thing I really want to discuss is a main thing to think about, because this is high risk stuff. They'll need a radiologic logical testing for that antelantal axial instability. So it should be evaluated. Risk for spinal cord compression actually is what they're at risk for. You want to assess for signs that you'll be looking for that antelantal axial instability is neck pain, weakness, torticollis. I'm pretty sure torticollis means a tilt in the neck, but I want to make sure. Torticollis. Oh, I can't display it. Well, let's see. I just gotta log in. So I think torticollis means slants in the neck, but I'm gonna make sure. So the risk for spinal cord compression is what this axial instability causes. Number one is the neck is persistent pain, loss of established motor skills, like think about your bowel and bladder control. Think of it similar to the exemplar I was talking about earlier with spinal cord injury, is what I'm thinking. And changes in sensation. These are signs, very severe signs. Okay, so children who are in sports, like let's say they're a highly active Down syndrome child and they're higher on the spectrum, but they have this antiaxial instability. So children in sports that involve head or neck, such as gymnastics, diving, butterfly strokes, high jump, soccer, you really want to check for this because they're at high risk of this spinal cord compression. Okay, so torticollis. We're gonna look this up. So this is going to be interesting. So this is a lot to think about. So with this Down syndrome, but the real takeaway is the respirations. So I'm going to torticollis. Where the definition is. Torticollis. We're gonna figure this out. All right, so medical definition of torticollis. Well, main thing to take away is you're going to see that tilt in the neck, and that's a big sign to monitor for. And other than that, that's everything. So I'm just going to look up the word torticollis and know it, and know that antilateral axial is a big risk for that spinal cord compression, which is associated with spinal cord injuries. All right, so that's everything, and good luck and happy studying.